Hi, John. Lovely to see you.
Hi,
I love
Gail.
to be a fellow trustee, which is fantastic. So, and thank you very much for agreeing to have a little chat today.
That's a pleasure.
We're going to talk about two aspects, really. One is your CLL, I can't think of another word but journey. So even though it's a funny word, your CLL situation, and also your role as a trustee.
Yeah, great.
Maybe start off by telling us when you were diagnosed, how you were diagnosed, and that sort of stuff, please.
I was first diagnosed in early 2014, and I mean, essentially, it was following a series of sort of flu-like illnesses, and I realised there was something wrong. So I went to the GP, had a blood test, and it came back saying that I had some form of, raised white cells, and subsequently that was, fully diagnosed as CLL. So that was in 2014. And I was then on watch and wait, relatively uneventfully for most of the time, until the white cells started to increase fairly rapidly. And it was time for treatment in 2017. And I actually elected to sort of try and join the FLARE trial, and you have to go through various sort of health checks and things to get on these trials. So I started in 2017 on the venetoclax and ibrutinib arm of the trial, and that I've now actually fairly recently finished the trial because I got to an MRD negative blood and bone by middle of 2019. So that was all extremely good news, and long may it last.
That's fantastic news and a great inspiration to everybody else on the trial, or even people that are having the treatment now afterwards. So you're diagnosed in 2014. You when we were having a chat beforehand, you used a fantastic phrase about CLL support, which I think I'd like to invite you to say again if you can remember. Which, because you googled a lot of stuff, as people do.
That's
and
right.
You found CLL support.
That's right. I mean, as anybody that's Googled any kind of illness or disease will have experienced, it's a pretty alarming kind of labyrinth and maelstrom of in many cases misinformation. And yes, I mean, I did finally get to what I think I described as a sort of the oasis of CLL, which was of the CLL Support Association website, because really it seemed, well, a number of things that came across immediately. One was that this was sensible, simple information that I could access, and perhaps most importantly, it was from a kind of patient perspective. It was really focusing on, well, what does this mean for CLL patients? Whereas all the rest of the sort of information I was looking at on Google and so on was sort of clinical stuff, which really seemed to almost exclude the patient from the process. The patient's just a number. So that was a great relief. It was this sort of sanctuary of sensible information and shared experiences, really, which was marvelous,
And then once you'd found that, which I'm thrilled with your description of it, actually, because I think it is true. All the trustees have either got CLL or a partner with CLL.
Yes.
So it is a patient-led charity. But then Fabulous decided to become a trustee, which we've been very grateful for, because you've worked enormously hard since 2015. And very sadly now you're stepping down, which is a bit why we're having a chat, because you've worked really hard, but you've done your time, and you're stepping down. And can you tell us a little bit about why you decided to become a trustee?
Well, I think, initially, when I was diagnosed, I decided to stop work. I was self-employed at the time as a consultant, but I decided that with the diagnosis, I didn't really want to spend a lot of time working, because I frankly didn't know how much time I had left, really. But at the same time, I was sort of conscious that I was, also looking for something worthwhile to do. And I'd been very impressed by the information I'd found on the website, but then also that had led to attending one of our member conferences. There was a Liverpool conference, because I live near Liverpool, and a couple of other sort of patient type groups that I went along to, and I just felt that this was both extraordinarily sort of worthwhile thing to perhaps be involved in, but also I think from a personal point of view, there was the opportunity to feel as if I was something other than just a CLL patient. I had a sort of degree of agency or control through helping, trying to help and support others in that sort of CLL community. I just wanted to be part of, in a way, this community of people sharing experience and kind of mutual support. Fortunately, I had the opportunity to apply because at the time the association was looking for some more trustees, and so I applied, went along to a trustee board meeting to sort of see what it was like, which was certainly an interesting experience, but didn't put me off. In fact, it actually made me more enthusiastic, because while the issues were difficult issues, we didn't necessarily have it all under control. The people were so interesting and welcoming and supportive. I thought, I actually want to be part of this. It was great. Yeah. So I became a trustee in the end of 2015.
Your story actually mirrors mine somewhat, in that I listened to you speak at a conference in Leicester, and because of listening to you speak and Brian, I then went up and said, "Hi, do you need any more trustees?" So it's
great.
Those conferences spurred us all on, and how we miss the conferences, I think, really.
Yes.
Every trustee has to do almost everything in a way, but tell us a little bit about the work that you've done for us, please.
Yeah. Well, I think the point you make about every trustee, in a sense, has to get involved in everything that we do. I think that's certainly true. But all of us trustees have a sort of lead responsibility for some area or other of the work that we do. And, that includes things like the members' conferences and the helpline and the newsletter and so on. And I've done quite a bit of work on the sort of the planning side of things, trying to help to put together our sort of strategy. But I think at the end of the day, being a trustee is not being about having just the responsibility of one particular area, because the great thing about the team of trustees is that it is a team that is very sort of supportive of each other, and there is a great spread of skills and capabilities and sort of personal qualities, and we all have to be prepared to collaborate and work together. So there is certainly a responsibility on each of us to take on a sort of lead in a particular area. It's not a case of saying, well, that sort of is exclusive, or you're not there on your own. But as I say, the bit I have helped with is the sort of strategy and planning, and one or two other things like that. But yeah.
You've worked immensely hard at strategy. I think you're being rather modest there. I think that what you've produced has been fantastic, which everybody is immensely grateful for, and obviously would want to thank you for that.
Well, that's kind of
you a little bit. You've got MRD negative, which is absolutely fantastic, and you are not taking any drugs at all, I understand. Is that right?
Certainly not for CLL.
Yeah. Sorry, you're not taking your venetoclax and stuff anymore.
No, quite right.
Yeah. Good. Well, that's also great for people to know, because it's sometimes you start these trials, or you start this, and it's a long way in the distance when you'll be told no more drugs.
Yes.
But you're fighting fit. You're very healthy. You're MRD negative, and you're loving life.
Yeah. I mean, I am extremely fortunate. It's there is a bit of luck of the draw involved in this kind of thing, but certainly my experience of CLL has been much more positive than I feared at the outset. I mean, there's no doubt about that, and I'm extremely grateful for the people that have cared for me, as it were, throughout the clinical trial. I mean, I fully expect at some point down the road, but I hope a long way down the road, I may well be back in their capable hands again, but hopefully not for quite a few years.
Absolutely. No, that's such a positive message to give forward and to give out to anybody. That the drugs are brilliant and they do work.
Yeah.
John, thank you so much for A, your hard work as a trustee, but B, giving people hope by telling your story, and looking so well and healthy, and and the age-old thing of living well with CLL. So thank you.
It's possible.
Yes.
Thank you, Gail.
Thanks. Bye-bye. Bye.
Bye.